because we heard from first hand from an Utoya survivor last year about the Utoya incident in Norway. So, for all of you who do not know or you were not present last year, Sinding Bekkedal is a survivor of 2011 massacre at the Labour Youth Summer Camp at Utoya, Norway. Last year he shared with the audience a powerful testimony of his experience with calling the emergency services on that fateful day, and we all heard about that. This follow-up session will consist of a deeper discussion about the lessons learned and the changes that are taking place in Norway after the tragedy. Let me now call the panelists. First of all, Sinding Bekkedal. Sinding, where are you? And also Niels Peter Bride, Senior Engineer, Fire Service Communication and Warning Director for Civil Protection and Emergency Planning in Norway. Steinar Olsen, Director, Department of Emergency Medical Services, National Directorate for Health, Norway. And I saw Ture before, so I see Jerome is trying to locate him. Okay, let us start. We heard last year from Ture, so let me hear from you as well. What's your perspective of what happened in Utoya attacks? Let me start with Niels.
Okay, I should like to have this map up if it's possible. I can see it here. Okay. There it is. Okay, what happened in Utoya and Oslo? It was 2 terror attacks going afterwards, and it started in Oslo, and this is the overview for what's happened. Nobody knew what's happened, and I have to say that these terror attacks, the 22nd of July, were tragic events hitting the pillars of the society. It was both scaring, chaotic and overwhelming. Norway has been a peaceful nation since the Second World War, and this is the first really big thing that has happened since that time, and our society is built on peaceful events. So it was shocking. It came in Oslo, the capital of Oslo, Norway. It came in a lot of messages into the PSAPs for the fire, the police, and the health service, and it was really scary. And we had trouble by finding out where exactly the accident happened, because the messages gave us different information. Next picture, please.
So there is a problem of locating?
Yes.
Okay.
The first was trouble with locating. I can take the next picture, I think.
Can we have the next slide, please? Sorry? It's working.
Yes, but oh, I'm sorry. Oh, thank you very much. This is what the agencies saw when they was arriving at the scene of the first attack. The picture up on the right side is the Ministry of Justice and the police and the Prime Minister's office.
So this is downtown Oslo?
This is downtown Oslo, in the middle of the center. It was a car fully loaded that went off outside the building, and this is what you can see inside the building in the picture below, and on the left side the other ministries was also very hard hit. Oslo Fire Brigade had a station nearby, but the blast went right down through the floor outside, and it was not so very kind solution, because the fire brigade was completely set out of work there. So that was the start of it all. Okay, we can take the next one, I think. Next picture.
Yeah. Just move forward.
Just forward. Yeah, you can have after 2 hours, the attack at Utoya happened. We did not what has happened in Oslo at the time being. We had heard that it was one single person who was making this attack in Oslo, but 2 hours later, we heard about this yacht camp at Utoya, where it was a lot of people hurt, it was killed people, it was attackers, and it was still shooting. We can take the next picture, please. One more time, I think. There, yes. And maybe one more. Maybe one more. One more. Yes. There you can see the distance between this. It was, how long distance was it, Steinar? Between?
45 kilometers.
45 kilometers between these blasts, and this was in a rural area, the second one happened in a small island, so we had very big challenges by handling all this stuff, I can promise you. And at the same time you can see these borders, these blue borders and the other borders, and it was not so very easy for us, because it was different PSAPs who were taking the messages in different districts. So they have to, at the same time, try to coordinate them, and we had also trouble because in some of these areas we had TETRA network up and going, but right on the place of Utoya we had not TETRA coverage. It was not so very easy, because you have to use the analog system there, and it was just on the between two systems there, so we had trouble. Okay, I think we can take one more, please, my friend. This was the 113 control room in Oslo, and if you take one more, you can see the next one that was in the neighbor county, and if you take one more, and you can see it was 3 emergency service from the health service that was taking in these phones from all these people who was in trouble up there. Steinar, do you want to complete and say something?
Can we have another microphone, please, on stage? Thank you.
So, one of the main topics or problems here were all the control rooms involved, and the difficulties coordinating the operation between these control rooms. In the health service we had 3 control rooms. The police had 4 or 5 control rooms engaged, and the fire service had 3 or 4 control rooms engaged. So the intercommunication between the control rooms was a real challenge for us and for those calling, because there was a lack of information flow between the rooms.
Excellent, thank you very much. Let me invite Toril here. EENA staff did manage to find him. He was on time last year, so you can excuse him for that. Gentlemen, what are the changes planned? What are things that are done differently since that attack? And in particular, is 112 implemented? Is 112 an emergency number in Norway?
We have 112 as the main emergency number in Norway as well. And at the same time, we have started immediately after these accidents. We started from the Ministry of Justice and Police and from the Health Ministry. They put on a commission to see what really happened and what can we do, let's learn. And they did make a lot of findings there, and this is put into a system, and it's a lot of work that's going on for the moment, and already have been started to make these systems better when we have these 3 emergency numbers as we have in Norway.
Okay, Steiner, anything on that?
Yes, we've done a major evaluation and we've found for the health service alone more than 90 key findings. And for the pre-hospital area, the EMS, we have 60 follow-up points that we've been working with in the last 3.5 years, putting into action this year and next year. We've also been building our network, so it's almost now nationwide coverage. That will be one of the big changes to enhance better communication between the agencies.
Okay, clearly as we see in the map, the two instances, the two attacks had a distance between them that was big, but also 3 different centers to receive the calls. That by itself is always confusing. Is there something changing regarding the interconnection of call-taking centers?
Yes, it is done in the area that now is managing Utoya as well. There have been co-locating police, fire and health in the same building with located. And it was at Utoya at the same time. It was already in test use, and it was that area had very well functioned. It was functioning well that way.
Okay.
So this is on this regard from us.
Okay. Let me ask Tore, what do you think about these plans? What do you think has changed as a citizen?
As a citizen, I think there's been a tremendous change, and there had to be because of the multiple failures that were identified in response to.
A little bit closer.
No, sorry. Which is, I mean, it's inherently a very extraordinary event. I mean, it's not something you plan for because it's not something you can imagine. But I believe that the technological progress that has been made in the emergency response services has been encouraging, even though as a citizen it seems to be going at much too slow a pace, but I'm very heartened that it is actually in progress.
Okay, again, the challenge is, and this is the important, this is why we're here. We have citizens and service providers that are discussing, the way forward. And we see progress made, and that's the encouraging thing to take home. Any comment?
Yes, I have a comment. It's going on a very big challenge in these days, and the government has decided to make a new organization for the police in Norway. They shall go from 27 districts and down to 12. This is decided by the government, but it has to be voted for in the parliament, and this process will go on, we think, in June. And if this will go through the parliament and it will go well, the fire brigades will be co-located with the police all over Norway in 12 districts.
Okay, that is great news. What about emergency services, medical services? Any changes there?
Yes, we are going through a planning phase now for buying new software for all the control rooms in the healthcare service. And those control rooms will be connected not only by the Tetranet to the police control rooms, but also in the future a common mapping system and a common system for exchanging messages. So we're looking into these issues, and the plan is to buy these systems end of this year or next year, and then put them into service. But this is a huge work to change a country's way of providing services. So it's not easy, and we see that, especially perhaps the police, they have a lot of projects going on, and all this has to be connected together to have a good result. And it's a flying machine, so we have to be careful changing flying.
Yeah, Tora is a high-tech guy that has punching cards here. So it's always good to know that low-tech and high-tech should go hand in hand. And I fully appreciate Tora for that. It's a good reminder. You need technology, but you also need a pen and a paper to write down things. And I appreciate what you just said. One last point from me. What about caller location? It seems that part of the Utoya problem, you just mentioned it, was to identify where was the incident. Is that improving at all?
I think we are working with making a progress for the call location in Norway as well. It's a technological challenge we are working with, but we think we have found a solution for the fire, and I think also, I will have to tell about the health, but I think that the police and the fire has found a way to solve this problem in a much better way than we had earlier.
Okay, Stein?
Yes, we work with the same solutions. But one of the problems at Utoya was that the GSM network was overcrowded. And we have some failure in that network as well, spreading all the calls around to the PSAPs. So it was many failures, not only on our side, but also on the provider's side.
Okay, thank you very much. Can I have questions from the floor, please? Yes, Dr. Arafat, and then the gentleman in the back.
Thank you. Yes. I understand you are going to co-locate the fire service and the police. And I have a question, though it might be, it's my favorite question. As long as you are reforming your system, why don't you co-locate everyone together? And there are examples, like Finland, for example, and so on. So is there a reasonable reason for not co-locating everyone together and for having the police and fire separate from the health? Thank you.
That's a very nice question. And we've been looking into that in Norway. In Norway we have a 30-year history of having health control rooms, providing the service for the inhabitants. And we've been looking into this question now. One of the problems is the size of the health service. We provide missions to 10 times as many calls as the fire brigade, for instance. And our service is by law a health service. And the organization of the health service is not the same as the police. Our districts are not the same and won't be the same because the interest and the usage of the service is not organized the way we organize the police. And we have separate areas to cover. So that's one of the reasons why we don't always co-locate our control rooms. We have that solution in one place in Drammen today, and we probably will have it in the Bodø area, because the local way we have organized the health service support co-locating. In the Oslo area, for instance, we have one control room covering almost all this blue area now. The police have 5, and we don't want to divide up Oslo control room again from the health service. So we have a different history. That's one of the backgrounds.
It's always a different history. Yes, sir. Can you identify yourself first?
I'm Simon Beresford. I'm of the NHS 111 service in the UK, which is a non-emergency service. For me, this is a really good example of the difference between the approach you need for emergencies and for non-emergencies. In Scotland now, since the Scottish Government became more devolved, they have one police force, they have one ambulance service and one fire service. While in England we have hundreds of fire services, 7 ambulance services and about 50 police forces. The coordination, when you need, for emergencies, you need a small number of organisations, but the ability to interoperate and to dispatch at a long distance. But for non-emergencies, we have to be responsive to local needs, and for that we can have small or organisational units, really. And that's the big thing for me, is the degree of interoperability for emergencies, is to get so that we can take a call in one part of the country and dispatch somebody somewhere completely different.
Niels, go ahead.
Thank you. I have to say, I'm representing the National Authority for the Fire Brigades in Norway. I have to say, I've been working with this emergency number system for a lot of years. I see that in Norway we have 5.2 million inhabitants. We have 63 PSAPs in Norway to have this. It's a long, small country, but it's something that's wrong here. So we will see if we can make the resources, collecting the resources in a proper way. And I have to say, on behalf of the fire brigades, we are going into the cooperation with the police with nice expectations.
Okay, thank you very much. Let me remind all of you that Norway will be detailing their plans for changes in tomorrow's session, so you will have a chance to hear more about their plans. Gentlemen, thank you very much for being here. Okay, it's about time you get rid of me. I would like to invite you to go for coffee and return around 11:20, so you have 20 minutes for the next section, the future of technology. Please remember that during coffee, we do have the Ventor track presentation from Insta in the Diamond Room. So during the break, Ventor track, Diamond Room, Insta.